This segment is sponsored by GBMC Healthcare.
Many people who have experienced loss wonder if they are grieving too long, if it's normal. Now, joining us now is clinical counselor for the Gilchrist Grief Service Department, Hillary Harrington. Hey, Hillary, how are you?
Good afternoon. I'm great. How are you?
Good, good. So, Hillary, is there such a thing as grieving too long?
Yeah, no, there really isn't. And I think a lot of people will ask that question of us. I think there's something wrong. It's been X amount of time. And we tell people grief is your own unique journey. It's a really unique process and will take as long as it needs to take.
And what does it mean to have prolonged grief?
It's a big topic lately. It's a new diagnosis, and there's a lot of controversy around it. Some people will say that it's really providing a label on something that shouldn't have a label. But what people are talking about with prolonged grief is really for a real small portion of people who are grieving, maybe less than 5%. And what they're talking about is if they're using a time frame of after a year, if you're still really having a hard time processing your grief, getting back into sort of normal routine and just not feel like you're getting better. But it's really for a small portion of people who are grieving.
And Hillary, there's so much going on, with the pandemic and COVID-19. So what's a healthy way to deal with this grief?
Well, we talk a lot about self-care. So one of the things our clients will come to, and they'll describe lots of different symptoms that they're experiencing during grief, and they don't realize it's grief related. So we try to educate people that grief is not just being sad and crying. You might feel it physically, just the way you engage in the world. You're just feeling off and really sad, anxious. So we want to tell people, well, we can't fix grief. We can help you deal with the symptoms. So learning about ways to cope with those symptoms, finding healthy ways, making sure you're drinking lots of water, eating healthy, staying connected to some supports. And obviously, I would be a proponent of telling people to talk to someone who really specializes in understanding the grief process.
Talk to us about grief counseling as we wrap things up.
Well, grief counseling is something Gilchrist offers. Any hospice program will offer a grief program. At Gilchrist, one of our strengths, I think, is helping people connect with healing. And individual counseling is one of the things we do offer. So it's a place to come and talk about how you feel, tell your story. Sometimes after a few months, after a loss, people feel like, I can't keep talking to my family or my friends. I feel like I have to protect them from what I'm feeling. Some people are just trying to figure out, what do I do next? So coming to a grief counselor that can, one, educate you or clarify your understanding about what grief is, developing some healthy coping skills, kind of coaching in a way of how to take those next steps to kind of re-engage in your life, maybe make changes, identify what things you need to do to feel okay going forward, because that's the goal. We want people to heal, and we need to continue to live even while we're grieving.
Hillary, thanks so much for joining us and for this great information. We appreciate you.
Thank you so much.